Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In recent years, India has witnessed a concerning rise in cases of depression, reflecting a silent yet significant health challenge facing our society today. This trend underscores the urgent need for awareness and proactive mental health support across all segments of our population. As we delve into this crucial discussion, it's essential to explore both the underlying factors contributing to this rise and the impactful strategies needed to address and mitigate its effects. So join us as we navigate through these important insights and initiatives aimed at fostering a mentally healthier India. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today we turn our attention to a growing concern that often goes unnoticed: the rising cases of depression in India. To help us understand the many layers of this pressing mental health issue, we are joined by the insightful and compassionate public health expert, Dr. Prachet Raghuveer. Dr. Prachet Raghuveer is a distinguished associate professor in the Department of Epidemiology at the Center for Public Health, National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru. A committed academician and public health expert, he has carved a niche in the fields of mental health and epidemiology, with a particular focus on maternal mental health and non communicable diseases. He holds a strong academic foundation with an MBBS, MD in Community Medicine, DNB, and a postgraduate diploma in Public Health Service Management. His professional journey includes academic roles at Yenapoya Medical College and Manipal Academy of Higher Education. Dr. Raghuveer's research spans mental health, non-communicable diseases, geriatric health, and community medicine, with notable studies on cognitive impairment in type 2 diabetes and stress related to online learning among medical students. At NIMHANS, he actively leads and collaborates on impactful research projects aimed at enhancing mental health services and public health strategies at both regional and national levels. Beyond research, he is deeply involved in mentoring students and young professionals in epidemiology, fostering a culture of academic rigor and compassionate public service. His scholarly work and leadership in epidemiological research have significantly advanced understanding in the intersecting areas of mental health and non-communicable diseases. Throughout his career, Dr. Raghuveer has been recognized for his contributions to public health, research, teaching, and community service, continuing to make a lasting impact in these fields. Dr. Prachet Raghuveer, TIP Media welcomes you, sir.
Thank you so much.
Thank you so much for your time today, sir. Sir, with the rising cases of depression in India, we are increasingly witnessing how this particular mental condition, continues to affect many individuals. Yet, a large number of people, they remain unaware, or, they are hesitant to reach out for support, let's say due to stigma and even misinformation. Uh, so, how can we, understand the underlying factors, which are contributing to this growing trend better? Uh, yes, sir.
Yeah, so a very valid question. So we
Ji.
need to know what has contributed to this increase in depression. So, and
Right.
it's not a single factor. It's not like somebody had a mosquito bite and got malaria or got dengue, or in case of tuberculosis, we all know that it's a bacteria. Those
Ji.
who don't follow those cough etiquettes, they are the ones who are likely to spread the disease. So here it's
Right.
not a single factor. We have multiple factors that could lead to causing mental illness like depression. So, first of all, we need to know that depression is a common mental disorder. So, when we talk
Right.
about mental health, we have common mental problems and we have severe mental disorders. So,
Right.
depression, anxiety, stress, obsessive compulsive disorders, these are some of the common mental disorders. And then we
Ji.
have severe mental disorders, like we have bipolar mood disorder. So, where there is a both mania as well as, so there's an elated mood, mania, and there's depression. So, they may have features of both. Plus, we
Ji.
have psychosis, schizophrenia, where they sort of, they may be suicidal, they may be hearing voices, they may be seeing people who do not exist in reality. So, these are all called severe mental disorders. So, depression is one of the most prevalent mental morbidity,
Right.
right? And like I said earlier, there's no single factor that is responsible. We have multiple factors. For example, we have urbanization, right?
Ji.
So it's good that there's urbanization. We have a lot of jobs that are being created for people. We have better opportunities. The standard of living also has improved, but it's a fast paced life with enormous stress, pressure. So it's like we are in a battle every day. So that
Yes.
has its own repercussions. So that could lead to stress. And if we are unable
Right.
to cope with stress, then that could lead to mental morbidity, not just depression, the other illnesses that I mentioned as well.
Right.
Plus, workplace related issues that has contributed. So there might be problems in adjusting to a workplace, long working hours, toxic
Right.
colleagues. So we all deal with this on a daily basis. But when it becomes too much, then that could make us more vulnerable. And we all feel very isolated. Of course, we have technology with us. We are all well connected virtually. But
Right.
at the end of the day, all of us are isolated because we don't socialize much, right? So
Right.
that could be one more factor. Lack of social support. So if we have a good family and it could be spousal support for those who are married, or parents for the adolescents and youngsters,
Right.
or children for the elderly people. So good family support, social support would give us some sort of a protection against
Right.
such illnesses. But lack of social support could be one reason that could be an underlying factor for depression.
Okay.
Plus, we have a lot of socio-economic determinants. If
Right.
money is too much, that also becomes a headache. But if people do not have the money with them, they go into
Right.
poverty, and that itself could be a struggle for depression.
Right.
Or unemployment. So, unemployment is on the rise. So,
Right.
when people don't feel productive, they are likely to be vulnerable and they may go into depression.
Right.
For youngsters, we have enormous academic stress, especially
Right.
the students. So they need to cope once they go to 10th standard or 12th grade. They have to write
Right.
entrance exams. There's a lot of pressure. Even parents have their own expectations. Teachers have certain expectations. If they are unable to meet those, then they become vulnerable. And
Right.
what you mentioned was a very important point. There's a lot of stigma,
Right.
right, for mental illnesses when compared to the infectious diseases, like it could be
Right.
even malaria or COVID. There was stigma there as well, but when we compare it to the stigma that is stuck with mental morbidity, that is nothing. So, what happens because of stigma? People don't come forward. Okay, what will my friend feel if I tell him that I'm feeling very sad?
Right.
Okay, what will he feel? What will my mother feel if I tell
Right.
that I don't have interest, I've lost interest in life, or if I'm unable to focus on my daily activities? So,
Right.
because of that, there's a barrier that leads to delayed detection. And because the detection doesn't happen at the appropriate time, the
Right.
treatment also gets affected, and the
Right.
prognosis or the chances of cure also get compromised. Then,
Right.
post the COVID pandemic, we have noticed several studies. We will find a lot of evidence which suggests that there were too many job losses. Many of them were laid off without even a notice period.
Right.
So next day they were asked to quit. So that has its own negative effect. There's a lot of loneliness because during COVID, all of us were isolated and a lot of
Yes.
online meetings mushroomed. Of course, we tried to use technology in the best way possible, but that made us more lonely. So loneliness now, WHO also has identified loneliness as a serious public health issue. So loneliness could be one precipitating factor for depression, and
Yes.
excessive social media usage. So we see that youngsters are on Facebook, Instagram, Twitter, and that itself may, impact their daily life. It may affect their sleep. And that could be another stressor. And of course, I must mention this as considering that we had some, you know, some unfortunate, gruesome incidents in our country. So
Right,
when that happens, okay, all of us are glued into the news, even in the social media, WhatsApp, these things are going on. We share a lot of forwards related to that. That itself could impact our mental health. So we call it as a digital overload because we have too much information available. Now,
right,
sometimes not having information available is, but when there's too much, when there is a technology overload, we don't know what to digest, what to assimilate. So that could
right.
be a stressor. And
Okay,
of course, among couples, we have seen that relationship issues could be there. That could also lead to depression. Substance use, those who are into maybe smoking or usage of tobacco or alcohol, that itself could be a stressor or one trigger for depression. So, and
right.
like I said, it's multifactorial.
Right, right. So you've actually given us, a good range of triggers that is actually, affecting our mental health. So now coming on to something, to let's just scale in this vulnerability level now. So who is, at a higher risk of developing depression in India, whether it's adults or children? And could you also help us outline, the factors that contribute to these differences between the two basic populations?
Another very important question. So, first thing that we all need to acknowledge is that anybody could get mental illness. So,
Right,
there is no discrimination. One might be a CEO of a company, one might be a student, one might be a housewife, rich
right,
or poor, belonging to this community or that community. Everybody may get it. So, anybody could get it. But
right.
there are certain high risk groups who are likely to be more vulnerable. Who
Okay,
are those? When we talk about women, pregnant women or postnatal women. So we have something called postnatal depression that's on the rise because the woman
right,
has to adjust to her new role as a mother, look after the
right.
child, look after the family. The responsibilities should not be
Absolutely.
neglected. There are high expectations, and plus
Right.
childbirth itself could be traumatic.
Yes.
It's a different experience, especially those who become mothers for the first time or those who have had a
Right,
very difficult labor. So
right,
that's there. So postnatal period or during pregnancy, that is one period where women are likely to be more vulnerable.
right,
Talking about children, we have adolescents. So that's a very vulnerable, tricky phase. So they are
right,
neither children or adults. So 10 to
right.
19 years, the World Health Organization says that somebody aged 10 to 19 years is an adolescent. And there are plenty of changes happening. Physical
Yes.
changes, growth spurt, secondary sexual characteristics appear during that time. And
Right,
they may be insecure because there's a lot of comparison, there's a lot of unfair expectations on them. So peer pressure, all these could lead to depression among adolescents.
right.
Then we have the elderly age group, those who are aged 60 years and above. So, what happens during that time? So, people who are working, they retire. And when they retire, they lose their livelihood, they lose their productivities. So, when an individual has worked non-stop for 25 years or 30 years, and then suddenly you ask him to stay at home for a month, it's very difficult. So,
Yes.
that could be another higher risk group, elderly people. And more often, though, we see when you look at the prevalence or burden, it's the adults who are more frequently diagnosed, especially those who are middle aged
Yes.
individuals, because there's the career stress they'll be facing, or they'll be having their own family related issues. It could be a
Right,
relationship with a spouse or added responsibility of looking after the children, looking after parents or other relatives. So, all these could lead to stress.
right.
So these are some of the high risk groups, and then somebody who's already gone through a mental illness.
Okay.
So there is an increased likelihood that they may get it again. So it's not
Right.
like okay, ek bar ho gaya, once they have got it, they've got cured. So there could be
Mhm.
a chance of relapse as well, right?
Okay.
So prior history of a mental morbidity could be one high risk group. Those who've had family members suffering from the same disease, like
Right.
depression. So that could make them more, uh, more prone for developing depression. So these are all some of the high risk groups that we have.
Okay. Right, sir. And now coming on to the clinical indicators for these high risk groups, I'm sure it's very important to start the self analysis, or let's say they must be aware of certain signs and symptoms, so that at least they can visit a mental health expert or their family doctor. So, sir, what are the common signs and symptoms of depression that individuals and their families should watch out for?
So there are two parts to that question. One is,
Yes,
as
sir.
you rightly said, we all need to be aware of what the warning signs are, right?
Right,
But at the same time, some of them, use these terms very loosely. Like, okay, one day they are sad, they think that they're depressed. I might be
right,
sad today because I've got lower grades in my exam, or I
right,
didn't, my boss scolded me at my workplace. That is
right.
not depression. So, depression is something that is diagnosed by a certified physician or a psychiatrist. So, what are
Right.
these important warning signs that we should be aware of? Number
Ji.
one, there is persistent sadness or a feeling of emptiness. They might be
Right,
having everything good, family support, and plus they might be having a bungalow, a car, but still there's a feeling of emptiness,
right,
right? Persistent sadness. It is consistent throughout the day.
right.
The other warning sign is loss of interest in pleasurable activities. So,
Okay,
routinely, I might be interested in playing a game of cricket,
right,
but those who are depressed individuals, they lose interest in their routine activities, something that they found interesting earlier. So loss of interest in activities, loss of interest in the routine, that's
right.
another warning sign. Many
Okay,
of them feel very fatigued. They feel tired for no reason. They may not have worked that much or worked hard, but still they feel tired or fatigued. So that's a
right.
warning sign. They may have difficulties in sleep, like insomnia. What we call insomnia is a lack of sleep or the
Mhm.
diminishing ability to fall asleep. So sleep
Right,
issues could be there. There could be changes in their weight or appetite. They might start overeating or eating less, or they might be weight gain many a times, or even weight loss. So that could be there. They
right,
have, very importantly, they have difficulty in focusing on a particular task
right,
because of the issues that they face. They have a feeling of guilt. Oh, okay, even though they may not have committed any mistake, they feel very worthless. They feel very guilty, and
right,
this could be a trigger for suicidal thoughts. They may feel like
right,
ending their life.
right,
And among the younger age group, like children and adolescents, they become very irritable. They become very angry all of a sudden. Or even
right,
adults for that matter, they become angry. But there could be an underlying depression that may have caused that
right,
anger. Or many
right.
of them, they withdraw completely. They, socially isolate themselves. All these could be some of the triggers which could tell us that, look, we need to go to a psychiatrist or a mental health professional and get ourselves assessed.
Right. And I'm sure, the mental health experts or the psychiatrists, they might be having their own, diagnostic, measures or parameters to confirm the diagnosis. So, sir, how, is depression identified by a mental health expert? And now coming on to the accessibility of these expertise and these resources for the diagnosis or for the diagnostic confirmation, that is it challenging to obtain diagnostic treatments for mental health issues in India?
So absolutely. So yes, psychiatrists, they get trained in depth on how to assess all these conditions. So they use
Right.
something called Diagnostic Statistical Manual 5 criteria, DSM criteria we call it. So
Okay.
it's a range of symptoms related to depression. And
Right.
if an individual has certain symptoms, then they are diagnosed as depression. Plus, we
Right.
also have the latest ICD-11 criteria, International Classification of Diseases criteria. So based on, they
Okay.
go by the book. It's not like, okay, this person is sad, so I'll diagnose him as depression. No. So there's a in-depth psychiatric assessment that may take an hour or so, or maybe
Okay.
even more than that, or 45
Okay.
minutes. So
Right.
it's an in-depth conversation that is going on. And based on this criteria, the DSM-5 criteria, they diagnose. So for
Right.
any diagnosis of clinical depression, the symptoms that I mentioned earlier, like sadness or loss of interest in the pleasurable activities, or weight loss or weight gain, difficulty in falling asleep, or too much sleep during the daytime,
Right.
irritability or feeling of guilt or worthlessness, reduced ability to think or focus on a particular task or concentrate, and those thoughts of committing suicide or ending the life. So there are around 9 symptoms. which I
Right.
mentioned, 9 warning
Right.
signs. If an
Right.
individual has 5 or more of these symptoms at the
Right.
same time, simultaneously, for a 2 week period, at least 2 week period, then it's a cause of concern. So
Okay.
that will really, tell that the person is more
Okay.
chances of getting depressed. So, and most
Right.
importantly, they should be having either one of these depressed mood or sadness or loss of interest or pleasure. We call it as
Right.
anhedonia medically, loss of
Okay.
interest or loss of pleasure. So
Okay.
those two, one of these two have to be there. So they go by the book. Based on this, they converse with the patient, with the individual. They try to find out what could be the triggers, and then they come up. They use this criteria or checklist and come up with the diagnosis after an in-depth assessment. Coming to the
Right.
second part of your question, yes, we have adequate number of healthcare facilities. We do. If we step out of our house, we find a hospital virtually in every street, but there's a
Right.
lot of disparity, right? So we
Okay.
have private sector, we
Okay.
have the government sector, we have the health and wellness centers or the primary health centers, and we have district hospitals, taluk hospitals. We do have a good framework or a good structure,
Okay.
but there are some issues in delivery of healthcare. So when we talk about mental health professional is a trained psychiatrist or a clinical psychologist or a psychiatric social worker. There is a huge shortage. There's a dearth of trained mental health professionals in India. Okay.
Right.
When you talk about psychiatrists, you'll be astonished to know that we have less than one psychiatrist per one, 1 lakh people. So, which is
Okay.
not at all enough for a big country like India. So, we have
Right.
shortage of manpower. And then we are coming back to that same thing again, stigma. Stigma is very
Right.
much prevalent, due to which there's a delay in health seeking. There could be geographical barriers when we go to remote areas or rural areas or backward areas. So the nearest health center might be very far away. So that
Okay.
geographical barrier could, could hinder healthcare accessibility. So they
Right.
might think, oh, why do I have to? I need to travel 20 kilometers to reach the nearest hospital to find a psychiatrist. Why should I do? Why should I take that pain? So let
Right.
me just leave it that way. So that's another barrier. So,
Okay.
and of course, we have NGOs as well who are doing their work, but there seem to be a lack of coordination. So it's good
Right.
if the public and private sector and the non-governmental organizations all work together towards
Right.
delivery of better mental health care.
Okay, right, Sam. Now, I'm sure that, once the mental health experts and the numbers are probably met, the things would be better in our country in terms of at least accessibility of these diagnostic resources. Right. Now, coming on to something that again is very important in terms of addressing the issue. Right. Like we've already mentioned a couple of times that the condition is stigmatized, it is full of misinformation. So I'm sure an evidence-based pharmacological and non-pharmacological treatment option would be the best, for handling the condition appropriately. And again, the question will have a second part that given the increasing number of cases, are these treatment approaches truly effective and again, available to those, who are struggling with this condition?
Yes, another very important question. Yes, we do have evidence-based treatment options that are available, both pharmacological as well as non-pharmacological. So, coming to the pharmacological, this includes drugs, this includes tablets.
Okay.
So, we have antidepressants. So, we have different types of antidepressants that are commonly prescribed by the psychiatrists, depending
Right.
on the profile of that individual. So, and whether the response is, and if the response is good, they continue with the same, or they might add another drug as well. So they
Okay.
tailor it accordingly. So antidepressants are available both in the private sector as well as the public sector with a valid prescription. So, of course, in the government sector, you might find only certain drugs. You will not find all the drugs. So, for the advanced drugs or the medications, one may have to go to the private sectors. But we do have options. We have Jan Aushadhi Kendras that are coming up, that from
Okay.
the government of India side, where we have these generic drugs that are available at a very nominal cost.
Right.
And plus, we have our private stores, chemists who sell these drugs with a valid prescription. So these are all prescription based drugs. The psychiatrist should prescribe these drugs sign and also put his or her medical registration number as well. So these are things that otherwise things get misused over here. So
Yes.
that's pharmacological. So once an individual is put on a pharmacological treatment, he or she may have to adhere to it. So we've seen many of them don't adhere to it. There's no compliance. So they may forget their medications, or that those medications itself could produce some of the side effects. So they discontinue the medications. So when that happens, the treatment outcome also may be unfavorable. So that's the
Right.
pharmacological component. Then we have non-pharmacological component. So here, this is where the clinical psychologists come into the picture, and we have
Right.
psychiatric social workers. So these are trained counselors. So they have therapy. So we have cognitive behavioral therapy or mindfulness based therapy. Sometimes they may prescribe certain exercises. We have found that certain forms of yoga or relaxation exercises or pranayama or breathing techniques, all these are also advocated as non-pharmacological treatment for conditions like depression. Sleep hygiene, because they could be having sleep issues. Sleep hygiene is another component. Diet, because there are certain foodstuffs which may aggravate depression, like oily foods, and it's important that they have a good, healthy, balanced diet as well. So these are all lifestyle-based interventions. Going for a walk, physical activity, playing a sport, all these are also a component of the non-pharmacological treatment. And good
Okay.
community support so is also very much required. So there has to
Right.
be support systems within the community or within the village or within the urban area, so that
Right.
individuals don't go back to depression again. But having said
Right.
that, those who are severely ill, they might advise them to go for the pharmacological treatment. Those who are in the mild to moderate category, non-pharmacological treatment will do a world of good to them. And non-pharmacological treatment is also effective to supplement the pharmacological treatment. So in addition to
Okay.
giving these drugs, they may also advise them some exercise or some mindfulness based therapy or cognitive, what we call as cognitive behavioral therapy, or problem solving counseling. It's basically these higher end counseling techniques that are used to ensure that the condition is better. So both of them,
Right.
they go hand in hand. So it's
Okay.
very important that they go to a qualified mental health professional. So there are people who might you do this online, but they may not be qualified. So that's one thing. Misinformation is one thing that seems to be affecting people. So it's very
Right.
important to look at access a quality qualified mental health professional. So that's about the treatment that we have. And I think you also asked about the barriers,
Right.
right? So accessibility gets limited due to various reasons. So we discussed
Right.
this even in the previous question,
Right.
the geographic disparities. So we have areas where uh, there there are several hospitals that have mushroomed, and we have
Right.
certain areas or certain villages where you don't find any health center or hospital or even a
Right.
dispensary. So there's heavy disparity. There's lack of trained mental health professionals, high
Again.
cost. And see, we have some of these drugs only could be available in the government sector. But
Okay.
but if there's an advanced drug or if there's a combination of drugs that is being prescribed, then the government sector may not be able to provide that drug. And when they go to the
Right.
private sector, there's the cost issue there. So
Yes.
taking it for months together, so that
Mm-hmm.
could be a challenge for them. So if they are not affordable, then they might discontinue it. And
Right.
somehow we have all these schemes. We have Ayushman Bharat, and we have many other private health insurance schemes as well. But somehow mental health is not getting that attention that it deserves. So,
Right.
okay, there's no insurance, so then they don't take care. And the entire treatment itself is chronic. It might warrant hospitalization. So hospitalization has its own costs. So they might
Right.
have to discontinue working for a lengthy period of time when they are severely ill. So that could be another barrier. So people think, oh, why should I sit in the hospital? I might rather go to work or sit at my home. So there might be lesser cost associated with that. So all these are some barriers that may have uh, decreased the effectiveness of the treatment.
Right. And I think just the cost issue you've mentioned here, that because of the high cost prices, let's say for the mental expert and even the medication, people are, forced to buy over-counter drugs, which may not be, scientifically
Yes,
approved, and which may not be right for their mental health. And they might just land up, into some completely different problem or a medical
correct,
health issue, taking
correct. So
taking
there
a
are
wrong medicine.
regulations. Yeah,
Yes.
another that's a burning issue actually. So there are regulations which, and all these by those regulations. They are not, they are supposed to look at the prescription and only give those
Yes.
drugs. But
Yes.
even then, there could be loopholes in the implementation. So
Yes.
some of them might just sell it on their own. So, and
Yes.
then when people take drugs that way, then they may get dependent on that. It's very difficult for them to come out of it.
Yes.
So
Yes.
that's an issue which has to be addressed.
Right, right, sir. And now coming on to something that I personally feel is very important, rather than just treating a condition, and that is prevention of any medical condition. So, sir, what preventive strategies you would suggest can be implemented, let's say, at the individual, family, and societal levels to address depression effectively?
I'm basically a community physician. So, but
Right, sir.
since I work in an institute that has done considerable work, it's a premier institute for mental health and neurosciences, and also
Right,
based
sir.
on my interactions with trained psychiatrists and clinical psychologists, I'm advising
Right,
this. So there are some individual level strategies that one might adopt. This includes physical activity,
right.
it could be just going for a brisk walk as well, like a
Okay.
half an hour walk per day, a brisk, quick
Right,
walk, or playing a
right,
sport of our choice, or going for a yoga or breathing techniques or relaxation techniques, all by a trained person. We should not do it on our own by
own.
looking at some
Yes.
online modules. So it's important
Right,
that all these exercises are done under close supervision of a trained expert. So
right.
that's at the individual level. Stress management, we all need to handle the stress. There's enormous stress, not just at the workplace, but even at home. We have responsibilities, could be spouse, children, or parents. So it's important that we handle these things at an individual level. It's very essential that we have good family support. Okay, many of them they don't disclose their problems to the family member. They think
Yes.
what he or she might think. That's all
Think.
because of stigma. We know that, and many of them are not aware that they are going through this. There's denial. Okay,
Right.
what has happened to me? So all
Hmm.
these. So there needs to be more awareness. Once people are aware, then they might open up. Once we stop stigmatizing people. So even now, even in the urban areas, somebody who is going through a mental health condition are stigmatized, or we do talk about them in a very derogatory manner. So that should be
Right.
avoided. So stigma has to be alleviated. Only then
Right.
these individual level preventive strategies will work out and people might open up or share how they are feeling with their loved ones. So that's at the
Abs-
individual level. Then we have family level. Again, open communication is the key. So
Right.
we have to openly communicate with our family members about our feelings or about what issues we are going through. So that will happen only when there's better awareness and when we take up measures to reduce stigma
Right.
and good social support. So, for example, a woman who has delivered recently,
Right.
the family members are unaware that she might be having signs of postnatal depression. So, it's
Right.
important that the husband, the in laws, and the mother or the father are aware that these are the challenges. Childbirth is a new experience and this could lead to depression if we do not manage it. So it's important that we engage with them, engage with the family members and give them awareness. So awareness is a key. Then people will be
Right.
able to disclose or support each other openly. Then
Right.
at the community level, of course, we have several initiatives. We have the National Mental Health Program, which is running from decades. And we have the
Right.
District Mental Health Program, which is being covered in almost each and every district of our country. And there have been
Right.
efforts to integrate mental health care into the primary health care. So if you
Okay.
go to the lowest health center, like we have the sub
Right.
center is for a population of 5,000. So there
Right.
is mental health help or some screening available there. The health worker
Right.
over there will be able to screen individuals and then refer them
Right.
based on the warning signs that are present. Even an ASHA now. ASHA
Right.
is an accredited social health volunteer, a worker of that particular village. Even they are
Right.
being trained on mental health. Of course, there could
Okay.
be loopholes, there could be challenges in the implementation. So there is
Right.
effort that is going on in the community. And every
Right.
each of these schools, many of these schools have counselors. There have been efforts made to integrate mental health into schools. There are several community awareness campaigns that are there. So even I belong to the sector of public health or community medicine. So we do conduct
Yes.
several camps and
Yes.
we go to schools, we talk about substance use or mental health issues. We try to
Yes.
address the adolescents, the teenagers, and even women for that matter, or elderly
Right.
people. So we do have these community awareness campaigns, and
Right.
there are camps that are conducted under the mental health program. So there are special camps that are conducted, and the warning signs are picked up. So there are screening tools that are given, or the health worker interviews the individual with these screening tools, and if there is a risk, then they are promptly referred to the higher health center. So there are
Right.
initiatives, but somewhere the coordination and the implementation needs to improve.
Okay. Right. And now coming on to something that all of us have been talking about lately is the the artificial intelligence and its implementation in medicine. So, sir, as per your opinion, what role does artificial intelligence play in the early detection, monitoring, and management of depression cases in India?
So we need to be very judicious. Just because technology is there, we can't use it. So it's
Yes.
an evolving area. Like you said, it's an evolving area. Yes, we do have AI tools available that could,
Yes.
that could look into the mental health as well. There are chatbots. There are many other
Yes.
apps that are available. So
Right.
yes, of course, it would be good to use that, but nothing can replace human touch,
I agree.
right? Because as doctors, as healthcare professionals, we are trained to be empathetic. We
Yes.
are trained to put ourselves in the shoes of that individual.
Yes.
So that empathy will be lacking. And of course,
Yes.
when you're sharing your data with an app, you never know
Yes.
when it could get misused. There could be privacy
Yes.
issues, right? And we have
Yes.
all these scams going on, right? Lot of
Right.
scams. So the contact details or something could be misused. So it's very
Right.
important to verify the identity. As an individual, I would go for a human doctor rather than relying on an AI based tool. But yes, the doctors also may use AI based tools
Yes.
judiciously when they are
Yes.
trained and when they feel empowered, when they feel confident enough, they might use it. So
Yes.
I'm not saying that it's completely negative. There are
Right.
positive aspects. It might aid them in diagnosing and supporting people better.
Yes.
Yes, so there are positive aspects, but we have to be careful here. So we can use it, but in my opinion, nothing can replace humans.
Yes. So I believe that what my personal opinion here is that it's important to understand that yes, technology again, it plays an important
Yes,
role. It can help us prevent a particular condition. It can
true.
probably, help me bridge the communication gap with my doctor, but can never replace my
Absolutely.
doctor.
It can never
Right.
replace.
Yes.
Yeah, and
I
even if
agree.
we are using technology, we need to be smart enough. We
Yes.
need to use our human brain as well. So
Yes. That's what
anything,
technology.
even writing a paper, we can do it through technology, but we need to
Yes.
use our human brain, because otherwise there could be many errors. We also have to verify
Yes.
it, and
Yes.
then that the humans cannot be replaced.
Right, I agree. Yeah. And now coming on to something again that we've been working for a very long time, you and I together, in our own respective ways, is awareness. So, sir, you could help us understand that why is health literacy important in combating depression? And how can awareness campaigns that you just mentioned that you have been conducting a couple of campaigns which helps, in screening the patients faster, help reduce this stigma around mental health?
So health literacy is different from being an educated or uneducated person.
Yes,
So I might be uneducated, but still I might be a health literate,
health literacy.
or I
Yes,
might be super educated. I might have done my PhD or master's, but I may not be aware of what happens in each of these illnesses. So health
right.
literacy is very crucial because it empowers people to
Yes,
recognize their symptoms and seek help properly. So, therefore,
right,
I spoke about some warning signs initially in the interview. So, if people
right,
are aware that these are the warning signs, then
right,
they can go to the doctor. It's important not to panic at that stage. Leave the diagnosis to the doctor. They are the ones who
right,
have studied. The psychiatrist is the one who has studied for ages. He or
right.
she has been trained for this job.
Yes,
So that will just give us a trigger. Okay, yes, so we have to go to the hospital now, and then just have a consultation with the doctor. So it's very
right.
important to be health literate, not just for mental illness alone, for any illness for that matter.
Yes.
And our country, this seems to be lacking. We are working on it. There are several campaigns, as you
Yes.
said, but
Yes.
a lot more needs to be done. We have just taken steps forward. A lot more needs to
Yes.
be done to reduce
Yes.
stigma, to create awareness about mental health in the community. In
Yes.
addition to this, I would also like to mention about the initiative taken by the government of India. We have National Mental Health Survey. The first
Wonderful.
phase was conducted
Yes.
in the year 2015, a
Okay.
decade ago, and
Right.
NIMANS was the implementing institute. So, in the first phase, 12 states of India were covered, and around
Okay.
40,000 individuals' mental health was assessed. So,
Okay.
the assessment was done by trained workers. These were
Right.
psychologists or psychiatric social workers or public health personnel who
Right.
underwent a 1.5 month training, and based on that data, we've got to know that 10% of our population who were surveyed had any
Right.
mental illness, any mental morbidity. And among those, around 5% had a lifetime prevalence of depression. Anytime during their life, they had depression, which is alarming.
Okay.
And in addition to this, we also found that there's a mental health treatment gap. Treatment
Okay.
gap means they know that they have a mental health issue, but they are unable to seek treatment due to various issues that we discussed, like lack of
Right.
qualified people, geographic disparity, cost, stigma, etc. So the mental health treatment gap was as high as 80%.
Okay.
So which is enormous for our country.
Right.
So based on that, the report that was given, that was submitted to the Union Health Ministry, there were some
Okay.
changes that took place in the mental health policies. Now we are going ahead with the second phase of the National Mental Health Survey. So we did a
Okay.
mega city survey during after COVID pandemic during 2022, right after
Okay.
the COVID pandemic, wherein we looked into the mental health of individuals residing in 6 cities. That is, we had the four metros: Delhi, Mumbai, Kolkata, and Chennai, plus Bangalore and Hyderabad. So that was done, and then in addition to that, now we are doing the National Mental Health Survey 2, which is which adds on to what was done in the National Mental Health Survey 1. So here we are covering each and every state and union territory, starting
Right.
from Kashmir to Kanyakumari. Every state and
Okay.
union territory is covered, and we are going to
Right.
have data of 2.5 lakh individuals at the end of this
Oh.
survey. It's an ongoing survey. By 2026, we'll be completing it. So
Right.
2.5 lakh individuals' mental health status will be recorded.
Okay.
And plus, along with that, we it's not just about assessment. We also
Right.
make use of this as an opportunity to create awareness.
Yes.
So we do make, because people ask us, of course, everything is done by taking consent. So when we do these
Right.
surveys, they ask us what is mental health? Why, what are these questions? Why are you asking these questions? Why are you asking me
Right.
about my mood, about my sleep, about whether I'm
Yes.
enjoying my life or not, whether I'm suicidal or not? So we give them
Right.
some awareness as well. So we sit with them, we give them some awareness. And plus, we also have a Telemanas initiative. So this is
Okay.
another government of India's initiative, and there's a toll free number 14416.
Okay.
So suppose I am having some issues with my mental health, I can call this toll free number, and this is available in around 20 languages, not just
Okay.
in English and Hindi. So it could be available in Odia, Bengali, Punjabi, Marathi, Gujarati, Kannada, Tamil. So almost all major languages we have this, and we get access to a trained counselor, so who
Okay.
will talk to us and then will advise us what to do next. So this is an
Right.
initiative. This is one of the flagship program of our government of India. So all, but people are not aware. So even during these surveys, we give them the number. We tell them, see, if you
Okay.
have any issue with the mental health, you can call this number, or
Okay.
you can talk to your nearest medical officer or the healthcare worker, ashas, or whoever visits the village. In case of urban
Right.
areas, we have the health workers who do the visits. So
Okay.
talk to them or talk to your nearest hospital, talk to your friend, and ensure that you get the right kind of help. So awareness campaigns play a very huge role in uh, ensuring that there's health literacy and also
Right.
reducing stigma. We need to normalize conversations around mental health and guide
Right.
people towards the right resources.
Right. So here, open communication, be it with your friend or a family member or your health expert, is the key here. And now, talking about communication, I feel that we started this discussion with two most vulnerable populations: the adolescents and the working professionals, the middle-aged adults who are actually, taking up the responsibility and they're taking the brunt actually. So coming on to them, how can schools and workplaces in India, you know, contribute to creating supporting environments, for mental health?
Yes. Of course, all schools need to have trained counselors. So I know
Yes.
that many schools do have counselors. We have student welfare officers. Even when I did
Yes.
my schooling, which was 2 decades ago, so we had a counselor who was attached to our school who would come once in a while. So
Okay.
everybody were aware that okay, there's a counselor. If somebody needs help, then he or
Mm-hmm.
she can go and talk to the counselor. So but people were still reluctant because of stigma. But it's important to have these mechanisms. We need to have student
Right.
welfare officers, trained counselors, train the teachers, train
Yes.
the students, right?
Yes.
So even though now there are some efforts to include life skills in the school curriculum. So the World
Yes.
Health Organization has recommends that 10 life skills have to be there in every individual. So life skills are now being integrated into the school curriculum, in the CBSE
Curriculum.
curriculum. Mental
Right.
health is also there somewhere, but we need to, reinforce that, anybody could have
Yes.
mental illness. It's not
Yes.
just important for him or her to identify what's going wrong with him or her, but also in
Yes.
the friend, because even the friends may need help, even other school children may need help. So more
Yes.
awareness campaigns, and there have to be more proactive efforts to include mental health teaching in the curriculum.
Yes.
So it's there,
Right.
but it would be nice if the counselors or the take classes on mental health, at least 1 or 2 hour session,
Right.
which would make a difference. So that's about
Okay.
school. Then we also
Okay.
have a school health program that's going on in the government sector. So every
Okay.
year there's a school health checkup that has to be done,
Right.
right? Even kids, when they get enrolled, sometimes there's a health declaration that has to be formed. Some schools have school health checkup as well that is conducted when the admissions are going on. So it's
Okay.
very important that these school health checkups go once in a year, and
Yes.
it's important to include mental health as well. So there's more emphasis on physical health. Okay, did they
Right.
have dental caries? Is there a heart defect? Or,
Right.
is there any fall or fractures? Or what's the weight? What's the height? Do they have any refractive error? Do they have any eye problem, hearing problem? In addition to
Mm-hmm.
that, we also need to include mental health. Somewhere
Mental
that is
health.
getting neglected, but at the same
Yes.
time, do not discriminate. I could hear some news reports that a child with autism
Mm.
was not was discriminated. So we should never discriminate, but it's important
Yes.
to include these in the assessment, so that would also help
Yes.
us identify cases at a very early stage and give them the appropriate help.
Yes.
So that's
Yes.
about the schools. And then you spoke about the other vulnerable
The
group
workplaces.
is,
Yes.
yeah, those who are busy with their careers.
Yes.
So for the workplaces, we do have some legislation. Like we have the Factories Act of
Okay.
1948, which gives us
Okay.
some, regulations in terms of how many work hours have to be there, how many leaves they can take. Plus, we have the ESI Act, Employee State Insurance Act. So if the earnings are below a certain level, they become beneficiaries of Employee State Insurance Act. So that talks
Okay.
about maternity benefit as well.
Okay.
Okay. So there are some legislations, basic legislations, plus some of the companies may have their own employee assistance programs.
Right.
So there could be some flexible work hours or some days where the entire team goes out on an outing. So to
Yes.
create more bonding, or there could be some special days, mental health breaks that they can take, or a special
Yes.
corner where they can have recreation, like playing a game of table tennis, or playing a game of chess or carom, or
Yes.
even a game of cards, or just listening to music. So we need to
Yes.
have these kind of initiatives. Companies need to take care of their employees. I know that many companies have that. Many of these
Yes.
major companies have recreation facilities within their workplaces.
Yes.
So, but it's important that it percolates to most of the workplaces.
Yes.
And it's important that the managers also are trained on how to identify these warning signs of mental health. So it's a huge
Yes.
task. It's easier said than done, but
Yes.
somehow, it should be a part of their, what do I say, orientation session that goes on, or the recruitment session after recruitment when they get oriented about the company. It's important that they are sensitized about mental health as well. And
Yes.
we do have many of these factories, or even healthcare, or other organizations, or colleges. We do have a doctor or a healthcare provider attached to these
Yes.
institutions or organizations.
Yes.
Yeah, that. healthcare provider needs to play a more proactive role and even look into the mental health as well.
Yes.
So
Right.
we
So,
tend to
so
ignore. We talk only about, okay, do you have this pain, that pain, or do you have
yes.
this issue? It should even focus on the mental health. So we need to be
Right.
more proactive and we need to encourage a culture of wellness, mental wellness. So there's no
Yes.
health without mental health. So that also is
Yes.
an important aspect.
Yes. I agree. I absolutely agree. So I am just going to, summarize this wonderful session on mental health awareness in India with a very important question. That's in your opinion, how can India address the problem of depression better through education, healthcare reforms, and public awareness initiatives?
Yes, of course. A lot has been done, like I said. So
Yes.
we have some structure. We have the National Mental Health Program. We have the District Mental Health Program, which may
Yes.
need further strengthening.
Yes.
Training is a bugbear. So everybody, the healthcare workers first need to be trained. And
Yes.
there have been efforts made to integrate mental health into primary care and also
Right.
address the shortage of psychiatrists by something called task shifting. That is, we train people from the lower cadre,
Okay.
not on everything, but what they can do at that level. Because,
Okay.
okay, for example, I can train an Asha worker,
Okay.
I can train her how to identify these one or two signs or symptoms of mental health
Right.
so that she can go to the field. If anybody has this issue, she can talk to her superior or the medical officer or doctor and
Right.
ensure that they give help. So that's at the community level. So we do
Okay.
have something that the implementation and training needs to improve.
Right.
Then we have plenty of self-help groups and NGOs. Even they have to be mainstreamed. So we need to
Right.
take their inputs also, and we need to mutually work together. We
Right.
have legislations like we have the National Mental Health Care Act of
Okay.
2017. Okay, so it emphasizes there are certain rights and responsibilities, or there are rights that even a mentally ill person has, but the
Right.
execution varies from one place to another. So it has to be
Right.
implemented in a better manner. So
Right.
that's talking about the legislations and the programmatic aspects. Then you spoke about education. Yes, it's important that everybody is educated, and the best place for that is start from a younger age. Schools
Yes.
itself. Make it
Yes.
mandatory. Ensure that life skills and mental health education is implemented in the schools and colleges.
Right.
So
Right.
start from a younger age, then okay, their mindset improves and they'll be able to accept or even they'll be able to advise their friends and family members.
Right.
And we will move towards a more mentally health literate country. So
Right.
that's
Yes.
important. And more
Yes.
healthcare reforms. We need to spend more on our health, so the amount that we are spending is not at all adequate. So we need to spend as a country. There has to be a political will. More budget has to be kept aside for health and mental health. More important. So mental health,
Right.
you'll be shocked that it comes up. If I'm correct, it comes up only up to around 2% of the entire health budget. So there needs to
Okay.
be an increase because the burden is more, and we need
Yes.
more trained people, right? So how can we do it? By ensuring that there are more number of postgraduate seats in MD psychiatry or clinical psychology. So
Right.
we need to ensure that the number of seats increase. So that's one way in which we can create more health manpower. So this is a way forward in which we can integrate education, healthcare reforms, and even the awareness campaigns and work towards ensuring that we address mental health problems.
Right, Sam. So, on that wonderful note, I really appreciate your presence with us today. And I'm hoping that the enlightening information shared, it will be valuable to many individuals who are fighting depression. So thank you so much for joining us today. It's really been a pleasure.
Thank you very much. Thank you. Thank you. Yes.
Thank you so much. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.